Howdy, everyone. Matt here. I got a question for you. What are your thoughts when you see physicians saying people don't need physical therapy after surgery? Let's talk about it. All right, everyone. First and foremost, let me introduce myself. My name is Matt. I am Matt the PT, coming at you with another video, another topic of something from the physical therapy world. And yes, I do have a new setup going on. I hope that you like it, and I hope to be able to add to it as we go along. But the thing I want to talk about today is a video I saw on TikTok, and it is from a surgeon who does a lot of joint replacements. Now, forgive me if I say knee replacement during this time. I just may slip up and say it, but I'm going to be talking about just joint replacements. And he puts these videos out. Looks like he is pretty new. And I want you to watch it and let me know what are your thoughts to this video.
Fallacy number 4, I need months of formal outpatient physical therapy to have a successful total joint arthroplasty. Absolutely false, total lies. The medical literature confirms that a home-structured, well-disciplined exercise program gets the exact same results in flexion, extension, strength, range of motion, and quality of life at 1 year as a formal outpatient program. We started this years ago because of the over-aggressive pathways we've seen in some therapy programs, causing increased pain, swelling, decreased range of motion, and poor results. This works. We've done it in thousands of patients, and it costs less. It is the standard of care in actually 2/3 of surgeons across the country. So don't listen to that baloney of your neighbors or your families that say, why aren't you in physical therapy? You absolutely need it. You absolutely do not with a good structured home program. Stick with me for more truth in medicine.
Now, if you watch that video, what do you think about it? You can let me know down in the comments. And there's just several points I want to make just make about this video. It's just kind of all over the place. Now, I will say I have had a back and forth with this surgeon in some comments and some other videos, and some other people have chimed in, and he is fighting for his life in the comments. And it's very refreshing to see this like wave of therapists coming out, and they're just pushing back on this person so much. And I will also say some people have reached out who know him, and I'll talk about that here in a minute. But I do see that there are several things that we really, really need to unpack in there. And I'll make some points about this. I'm going to say there are some things I do agree with. That aggressive range of motion after a knee replacement or a joint replacement is not needed. And that's what he's been trying to say in the comments. He just kind of backtracks in the comments and goes, oh no, you shouldn't be overly aggressive in the beginning. And he tries to say in the comments that was the point that he was making. No, this main subject and what everyone is commenting on is about how you're saying that people don't need rehab. Now I'm going to say, yes, I agree. You don't need to be very aggressive with trying to get range of motion right after a joint replacement. I'll tell you an example with personal experience. Anytime I've ever seen people pushed really hard after a knee replacement, the knee just swells. It swells and it gets so hard to move. I saw that early on and go, wow, I don't really want to do that. I think of it like I'm negotiating with the knee. Okay. I'm kind of just moving it along. I'm not trying to be real forceful with it. I'm just trying to negotiate it to go along this thing of getting to move better, getting their pain down, getting their swelling down. Those are the things that I'm trying to do. So yes, I would totally agree that you should not be super aggressive right off the bat. Now, he does make a very interesting comment to me, which I'll share that comment here. Now, he came back at me with this to say like, oh, you don't need to be, you need to be taking your narcotics beforehand. Who's telling them that? I have never told a patient to take their medication before coming to therapy. I've never told them that. Okay. I tell patients I would prefer, if possibly, that you don't, because I want to understand what is going on when we do things. Okay. I want to understand that if we're doing something, is your pain being masked by a medication? Even if they're not coming for a surgery, I let them know. I would prefer maybe that you don't. Now, again, if you're having a flare up or you're having some inflammation, you possibly do. But we want to know what your pain is doing while you are in here. And I will tell you, and you can tell me this too, the person that I have had tell patients that you better take your pain medication before going to physical therapy, it's been the surgeon. Almost every single time. It's been the surgeon that will tell the patient, I'm going to write you this pain medication for prescription for pain medication. You better take it for therapy. They're going to beat you up in there. It's been the surgeon. So if this dude wants to put that out there, well, buddy, you need to go talk to your colleagues. You need to go talk to those other surgeons to let them know they need to change the language that they are using. Now, I'm going to say this other thing. I do think some patients can just do well on like a structured program. I really do. However, that's really going to depend upon the person. Okay. If you as a PT, OT, PTA, CODA, any of that, if you've worked with patients, think about through all of them. There's probably been a population of them that you say, you know what? I feel like this person can handle it. This person right here, if I just gave them a program and we just do a couple check-ins and I just tell them what to be on the wear out, what to do, they are going to do it. They are going to do it to the T. They're going to push themselves enough and they are going to do it. But I will tell you, and if we want to, again, use personal experience as a frame of reference here, because in the video, there is a mixture of like some evidence, but he never cites it. Okay. I may talk about that in a second, but like personal experience, I want to say personal experience from the literal probably thousands of knee replacement patients I've seen through my career. The vast majority of them, and I'm going to say it's over 51% of them, need somebody to help push them along. Okay. People are not really motivated to do that. They're not feeling good. Okay. It can be hard to do things. Do they know how to get their quad firing? Think about it again. When somebody comes in after a joint replacement, how often do they have a good quad contraction? Okay. That you're trying to teach them. Okay. Now I made a video a while back about how like unathletic the average person is. And really, I mean, to watch people try to run or jump, people have a hard time with coordination. I'm not knocking them. I'm not saying anything's bad about it, but people can have a hard time with just doing coordinated things. How do they feel? How do you know what a quad said? How do you make this muscle tighten up? What is that supposed to feel like? That kind of feels uncomfortable. I don't think I need to be doing that. How do they know those things to do? How do they know when to actually push into when they're working on their motion? How do they know when to push it? How will they know that it's too much? Okay. I'll tell you one thing I've given people for years is like a heel slide. I like doing that for a knee replacement. There's something to just get it moving or just riding on the bike. How often have you had people the moment they feel a little bit of discomfort? No, nope, I'm not doing that. Nope, I'm not doing that. Nope, I'm not doing that. So these people just don't push themselves into doing it. So there needs to be people that work with somebody on understanding what to do. Now, there's some other things that we do in therapy, and I've had those people do that. We're going to check for signs of infection, make sure that incision is healing. We're going to make sure there's not things like blood clots. The home health therapist I know, they go into people's homes. You know what they're doing? They're checking to make sure that they are safe in the home, that the stuff that they have and the access they have around their house, that they are safe in actually doing those things, that they're not going to get hurt while they are in their home, while they are coming through that. That's what we do as therapists do. We do all of those things. Now, there's been some other interesting things that he's tried to throw out, because when I see this stuff, he's really trying to make it sound like people aren't like that these pet therapists are all out there just beating up patients. And he's just trying to do the right thing. I'm trying to do the right thing and educating and all of it. But I'll make this point. Okay. I'll make this point, and you can chime in. Let me know as well. Please let me know on all this stuff. You can chime in on everything. I keep saying that. How often is this guy, do you think, sitting down with therapists? And I'm talking about actually sitting down like this. Hey, there's some evidence that we probably shouldn't be super aggressive with patients. We shouldn't be doing that. Here's a protocol. Here's this stuff. What are you seeing with people as well? Do you think he's actually doing that? I asked him that and he never answered it. How many times have you had a surgeon come to you and actually sit and talk with you about things that go on with recovery and rehab? How often? I haven't had any. I've maybe, walked through an office and mentioned something to a doc to be like, hey, could we do this or could we do that? Sure, yeah, you can do that. Or I knew a couple that kind of knew at certain points in their rehab with certain things that they wanted to do. So that I knew, but it was never sat down and actually had a conversation. It's actually funny because it's most of the time, if a surgeon ever calls you, a doctor, they want to yell about something. And I will tell you what, I don't put up, surgeon has not, or any physician has not called and yelled at me, and I would not put up with that whatsoever. And I say that no one should put up with that. You should never allow anyone, no physician, any of that, to ever call and raise their voice at you. Okay. Never, ever, ever allow that. Okay. Stand your ground because you're most likely doing the right thing. But he's, again, making it sound like, oh, these therapists are just beating up people and they're not doing it. But that's a big thing. He's not taking that into consideration. And this was the thing, actually, I saw there with people commenting, and some reviews I found about this guy, that he doesn't listen to the patients. He doesn't. That patients have begged and pleaded with him to say, I want to go to therapy because I'm still having problems. He won't do it. He just gives them a sheet, sends them out the door. You know that thing that people, that kind of crap on therapists, oh, they just gave me a sheet of exercise, tell me to go home and do this. He seems to be doing that. Oh, just do this stuff. Just do this stuff and go on at home. And therapists are saying in the area, they're like, we have to clean up his mess. We get people so often that will be one of his patients, and we have to get this person functioning again because he would not send them to therapy to do anything. Now, I did say that he did reference an article, and he never said what. Okay. I did find a couple. I did look them up. I did find a couple. And one of them did say that, like, Total Hips, they can do a supervised program. I would agree with that. The majority of Total Hips I have ever seen, and I've seen so few of them, do fantastic. I tell the patients, this first visit, you came in on a walker. Second visit, you're going to come in carrying the walker. Third visit, you're probably going to come in on a cane. Fourth visit, you're going to come in carrying the cane. And by the fifth, sixth visit, you're just going to walk in here. And it's been like that almost every single time that I've ever seen them. Typically, any hip replacement I'm seeing, unless they have some other health issues going on, they're not coming to therapy. Knee replacements. And I've seen some conflicting things on that. One that was saying that people do great with knee replacements and they don't even need to do therapy. They don't need to do any of it, but it did say that they need more. But the other one said that it's kind of hit or miss and it kind of depends upon the demographics. Okay. But I think that really brings up a thing again with all that evidence. And it really seems like this guy, I'm just going to look at the evidence. So this is evidence I said, and he's dismissing patients from, again, his reviews. It seems like he's dismissing people and not actually talking and not wanting to talk to the individuals who spend way more time with the people who go through these surgeries, and that we talk to them about their limitations and we work with them on that. Okay. And I will say this, I have had far too many patients go back to their surgeon saying, I can't do things. I can't walk as far. I'm walking really slow. I can't do stairs. I have a hard time getting off the toilet. I can't quite get my arm in the right position to get dressed. I can't stand long enough. It's a hard time taking a shower. It's doing this stuff. And guess what their surgeon said? No, you're fine. You're done. You don't need to do more therapy. Just go and walk. Okay. Just go to the gym. Just go do those stuff. They just blow them off and send them. And I tell every patient, I said, when they're telling them they're going to write the doc, I said, if you feel like you need to come back, you say that you want to come back. And if they won't grant it, you don't have to listen to them. You don't have to. They aren't the one in control of your life. If you feel like you have a limitation that you can't do something, you can come back in. We can find you a doc or whatnot that will listen to you. Okay. You don't need to do this. Now, I would like to know your thoughts about this whole video and this whole situation through there. I think really that this guy needs to actually sit down, check the ego. Everyone just check the ego and listen to us on the therapy side of it. He seems just to be trying to throw all these therapists in the original video into just this one big group. But when he gets into the comments, all of a sudden, like, no, we got this, and no, you got that, no, you got this. And it's not turning out too well there. But let me know your thoughts, opinions, beliefs down in the comments. If you enjoyed the video, hit that thumbs up button. And of course, subscribe to the channel. It doesn't cost you a copay. And until next time, take care of yourself. Take care of your patients. I'll see you then.